Good morning, everybody. If you asked, how do I feel about being here this morning after the introductions that we've had, I feel slightly uncomfortable as a man. I feel slightly embarrassed as a man. And think, what can I do about some of the things that we've heard about this morning? And I suppose if we actually take the idea of sexual violence against women as a public health issue, for me, it's straightforward. It is. I think the point of today is how do we make that meaningful for Public Health Scotland going forward. So part of the background to this, I'll say a little bit about who we are, what our ambitions are. But I'd just like to give a couple of nice statistics around creating Public Health Scotland as a new organisation. On Wednesday this week, our first ever Chief Executive, Angela Leach, currently with East Lothian Council, will be the first Chief Executive of Public Health Scotland. She was one of 3 women who were shortlisted for that post as a Chief Executive of a significant public body. We had 171 applications for membership of the board of Public Health Scotland, and last week we shortlisted for the 7 vacancies that there are, and we shortlisted 10 women and 12 men. Now, you might think that's not particularly remarkable, but in the world of public appointments, that is a significant statistic, and I'm confident that we'll get a really, really good field from that. So my role is I'm the shadow chair of Public Health Scotland. What that means is it's shadow because it does not exist yet as an organisation. We will become a legal entity, I think, in the first week in December, and I would come out of the shadows and become the interim chair of Public Health Scotland. Our vesting day is going to be the 1st of April next year. So it's quite a simple definition. I think that the point's already been very, very well made in a very articulate way. It's everybody's business. It's not just down to one agency or about improving Scotland's public health. It's Scotland's problem. So that's why it's already been mentioned, the multi-agency whole system approach is something that drives the way that we're going forward. We were recently asked in a discussion with politicians about why didn't we have powers of direction to force things to happen. And partly because that's not worked. It needs everybody to agree to make it work. And so therefore, when we go forward as Public Health Scotland, we can only do it as part of a whole system. We will rise to one of the leadership challenges that's already been made this morning. That is one of the challenges that Public Health Scotland faces, is to say, if we want to take this forward as an issue, to make it real, how do we provide the leadership for that? So part of the background to this was a process, a review of the public health system in Scotland, the public health directors and NHS boards, linked to the Health and Social Care Delivery Plan, and part of that led to the idea of Public Health Scotland being created. There was a big consultation around the setting up of Public Health Scotland, and again, it's an interesting statistic for me, maybe not necessarily to you, but there's 185 responses to that consultation, significantly from the third sector, who said we want a voice in this, which I think is important and something that we have to live up to in terms of our ambitions. So that's part of what we're doing. So part of my role is in that middle bullet point there, to create the new public body. We've heard some of the issues that support that. There's a map that speaks for itself. Scotland's position in Europe and Scotland's position in the UK. And it's one of these remarkable things about postcode lotteries. On one of my first engagements as the chair of Public Health Scotland, I was thinking about the life expectancy issue around where I was born, which is Clydebank, and where I live now, which is North East 5. And in the course of that, I've added 3 years to my life. And as you travel through different parts of this city, you add and subtract years to your life. So there's a big challenge for us around addressing some of that. I don't understand some of the science behind this. That's for the world of public health professionals. But I think that the headline story that it tells us around poverty and inequality is at the heart of the challenges that we face, and particularly for women. Not just in gender-based violence, but in every feature of public life. I was here earlier, and so there was I don't know if any of you were here, there's a kind of running slideshow of some of the key statistics about gender inequality. And I said, it just makes you feel a wee bit embarrassed as a man. So these are some of the things that's driving us.
The health and well-being of the people of Scotland faces three major challenges. Our relative poor health compared with the rest of Western Europe, significant and persistent inequalities, and unsustainable pressures on our public services. To help meet these challenges, the Scottish Government and COSLA are creating a new national public health body, Public Health Scotland. The organisation will provide strong leadership as Scotland's national agency for improving and protecting health and well-being. We'll work with national and local government, the NHS, existing partnerships and the third sector to better support communities. We'll drive change through the innovative use of data, intelligence, research and evidence. We'll work collaboratively and will provide effective support for health care, health improvement and health protection. Public Health Scotland's values have been shaped and agreed by people and organisations from across the country and will define how we work. We'll be accountable to the Scottish Government and COSLA for driving improvements in the nation's health, and for working with local and national partners, as well as the wider system, to make a difference in our communities. Our ambition is for Scotland to be a world leader in improving and protecting health and well-being, and Public Health Scotland will play a key role in making that happen. We'll use our highly trained staff, new ways of working and strong lasting partnerships to develop the best solutions to tackle Scotland's public health challenges, both now and in the future.
So that's a bit about who we are and how we tend to go forward. I think one of the things that I find really interesting in this role is that starting out from scratch is that we're not repairing something that's broken. Organisationally, we're bringing together some fantastic expertise and trying to use it in a new way. So we have these ambitions for Public Health Scotland, and partly that's how we will be judged. People will say, you have these ambitions, how have you realised those? And so part of it, again, the feedback from today's workshop sessions will help us flesh out what some of these ambitions might actually mean in reality. The point's been made several times now about whole system joined up working, and that's at the core of what we want to do as Public Health Scotland. It's a bit of a busy diagram, but part of the process, and again part of the reason why I'm here today, is helping us to define what are the parameters of the whole system. As I said, with 185 responses to our consultation, and with the best will in the world, I can't get round all 185 organisations that responded, but we can try and get to them through their collective bodies and agencies. And part of the one that I perhaps draw attention to there in terms of the roles that I have, so one was to appoint a chief executive and an executive team, tick. Appoint a board. Most of January is going to be taken up interviewing those 22 candidates to achieve that. And the third is about purposeful engagement. So early on in my tenure in this particular role, I have invited myself onto the back of people's conferences to just say, here's who we are, here's what we're doing. But perhaps the idea there about purposeful engagement. And there's a real purpose about today's engagement because of the agenda that we're here to discuss. How will that feature in the work of Public Health Scotland is through purposeful engagement as opposed to nominal engagement. I recognise very much, Anne, the send somebody along to the meeting syndrome. So for us, it's about purposeful engagement. And just to give you an example of the kind of conversations that I've had in that area, is early on is with the Scottish Fire and Rescue Service. Because one of their key roles as a first responder is around health and well-being, is when they're the ones that are asked to kick in the door because neighbours are concerned about, they think somebody's fallen or whatever. So they have a brilliant strategy called Safe and Well. And that seems to me to be part of the landscape that we want. And last week I spent some time with the Chair and Chief Executive of Food Standards Scotland, because we have something in common about protecting the population in different ways. So that's purposeful engagement. Just to finish on this slide, we're at the start of this journey about creating the organisation. Some of the early steps I think we've done really, really well. We're off to a good start, and I think if I was to encapsulate what is the purpose of me being in this role is to allow Public Health Scotland to get the best start that it can. So part of that, against the ambitions that we set ourselves, is how we will be judged over the next 3 years. At the moment, I'm working with colleagues in Scottish Government and COSLA to agree what the strategic priorities for the organisation Public Health Scotland are. But they are intimately linked to the ambitions that we described earlier on and Scotland's public health priorities. You can find out more, as they say, at the following address. Thanks very much for inviting me along, and have a great day.